Are you a surgeon or physician struggling to keep up with your medical documentation? You're a surgeon or physician, you're on a busy clinic, you've got back-to-back patients, you're getting through them quickly, you want to be able to dedicate your time and attention to each patient so you can understand their circumstances and give them a satisfactory experience. Somehow you've got to find time to get your notes done. Somehow you've got to find time to write the letters to the referrers. Somehow you've got to find the time to keep up with this all. You've got competing demands on your time. You wish to see your patients. You want to get as many patients into your clinic as possible. You're referring patients to surgery or to other specialists. You want to give them a good experience. Meanwhile, you're left with little time to create thorough documentation. When you're time poor, the tendency will be to create less detailed documentation. Traditionally, doctors would dictate their notes. And I've heard some doctors' dictations which were beautiful to listen to, but they were no doubt extremely laborious for the doctor involved. Alternatively, doctors can type their own letters. Many doctors I know prefer still to type their own letters. When you're time poor, it's tempting to create super short notes. Often surgeons will have some kind of coding system or shorthand system which it can be meaningful to them, but will leave a lot of detail unspoken or unwritten in their notes. The risk of inadequate documentation is when something goes wrong. If and when something goes wrong, you want to be able to refer back to your notes and have thorough, detailed notes that clearly set out the basis of your decision making. As a surgeon or physician, you are required to make decisions. And when people question those decisions, the better your notes are, the better you can substantiate how you made that decision. Remember, people might be asking these questions about your decision somewhere months down the track. Maintaining the process of documentation can disrupt your workflow. You've got your person on the front desk, you've got your secretary, you're trying to keep following through your patients. Meanwhile, depending on the way that you take your notes, you then have to get that information to someone, whether it be a dictation service or typist, find a way to get that information to that person to document, to create the record. Every manual process, as your practice grows, creates a risk of error. Taking notes manually through using pen and paper is great because it's immediate and you can use it as a way to record your notes. But what happens if those notes go missing? What happens if those notes don't get acted on? What happens if people can't read your notes? If you've dictated, what happens if that dictation doesn't get added to the right file? What happens if there's an error in your manual processing of all this information so that it doesn't get attached to the patient's file properly? All of this, plus the time it takes for you to look after all of this, just takes your time away from looking after your patients, growing your practice, doing your CPD, spending time with your family. It's just a time suck. Your professional liability can be on the line without adequate notes. Legal defenses will often turn on the quality of your notes. I'm a really big fan of AI note-taking tools. There's several different ways you can take your notes using an AI dictation tool. For efficient documentation, we suggest using i-scribe. i-scribe is an AI dictation tool. It efficiently creates an accurate record of the episode of care that you can go back to, the raw recording. You can use the AI output of that episode of care. i-scribe produces multiple outputs: letters to GP, file notes, letters to the patient. Doctors no longer need to spend the time manually generating notes. They can use the AI output in several different ways that are all streamlined, all seamlessly fit into your process. The output can be picked up by the secretary and put into letters and sent out using a patient management system. It's just so much quicker, so much simpler, saves so much time. Comprehensive documentation enhances your practice by creating a paper trail, an auditable trail of your decision making. It can be referred to by MDO, it can be referred to by lawyers, it can be referred to by you when you want to go back to understand the decisions that you made. Improved documentation, improved communication with your referrers will give them a greater sense of confidence when they refer a new patient to you. So in addition to looking after their patient and making sure their patient has a good experience, if you promptly reply to a referrer with a detailed analysis of your decision making and your proposal for patient management plan or how you're going to care for that patient, the referrer is going to feel a lot more confident referring their future patients to you. If you'd like to learn more about i-scribe, comment below or reach out to us. We'd love to help.